Hi, I'm a physician and I'm here to tell you that health disparities matter. African American men die on average 10 years earlier than white men in the city of Chicago, and that disparity has persisted for 20 years. It's time to do something about it.
Once a Russian-speaking woman came into our office with a letter in Russian, and she asked us to translate it into English and send it to the local hospital. The letter said, "When the hospital asked my older child to translate for the birth of my new baby, I felt like an animal, zvier. But later, when the hospital offered me an interpreter for the birth of my next baby, I felt like a real person, nastoящий человек."
You know, oftentimes providers, I walk into a training room and they think that what I'm about to tell them is irrelevant and completely peripheral to the real work. And I tell them what I'm about to talk to them about, that cultural competence is as important to the outcomes of their patients, is as important to the mortality and the morbidity rates as anything that they're going to do in terms of pharmacology or surgical procedures. In order for a patient to be healed, several things have to happen. They have to come to the medical facility. They have to give a complete and accurate medical history. The provider has to order the correct diagnostic tests, and then the provider has to make the correct diagnosis and develop the best treatment plan for the patient. And the treatment plan has to be one that the patient understands and is motivated to follow. All of those steps require a good relationship between the provider and the patient. It requires trust, and that is completely dependent on the cultural competence of the provider.
What we've seen, for example, within the Latino population in an area of New York State is their lack of awareness to language access resources. So not being able to communicate with their providers, it causes a barrier which contributes to health disparities, such as not seeking preventive care, not finding somebody who would be able to deal with primary issues, but unfortunately having these medical issues escalate to a point that they become one of the statistics that are recorded in health disparities issues.
America's a country that's getting more diverse every day, and that's a challenge for healthcare organizations. Doctors, nurses, they want to treat people the best way that they possibly can, but they don't always know how to do that. And the great thing about the Clas standards is that they provide a path, a journey, a roadmap for getting to better quality care and to really deliver care that's very patient-centered. And when hospitals and doctors can do patient-centered care, that means that not only do diverse populations get to be healthier, but everybody gets to be healthier.
I want to tell you a story of a community health center in North Carolina where they were trying to incorporate health literacy practices with their population. And they decided that they were going to ask their patients to explain to them how they were going to take their medicines. And they were astonished. They found that 9 out of 10 times they uncovered mistakes that the patients would have otherwise made had they not had a chance to confirm their understanding and correct it. So this is an incredibly important issue to address for safety as well as communication.
Cultural competence and language access matter. We've heard it all. The abusive husbands asked to interpret for their battered spouses and girlfriends. A young mother of a dying baby asked to tell her husband to interpret for her husband the baby is dying, and the husband who yells back, "You're lying, I don't believe you." A Haitian woman pregnant, treated at a hospital and released for dizzy spells, who then weeks later learns she had an abortion there without her knowledge or consent. And the kids asked to interpret everywhere. Tell your dad he has HIV. Tell your mom she has advanced ovarian cancer. Tell your auntie her fetus is dead in the womb. We've had cases, 2 cases of children as young as 3 being asked to interpret for their own pediatric encounters. And an 11-year-old boy who was asked to interpret for his own mother and told her, "Please don't cry, Mama. They tell me I have cancer." If it isn't culturally and linguistically appropriate, it isn't healthcare.
Do you think language doesn't matter? Nelson Mandela says, if you talk to a man in a language he understands, that goes to his head. If you talk to him in his language, that goes to his heart. Ensuring those who come to us for help understand the care they are receiving is essential for their satisfaction and safety.
I once interpreted for this elderly lady who had been coming to her primary care physician with her grandson to be used as an interpreter. It turned out that the information the doctor was obtaining through me was so different from what he had been getting through the grandson that he felt he really didn't know this patient, although he had been seeing her for the past 20 years. So he decided to cancel the rest of his afternoon appointments to really get to know her patient through an interpreter.
A Chinese interpreter once told me this: when a non-English speaking patient comes to the hospital, everything is strange. The sights are strange, the sounds are strange, the smells are strange. The only familiar thing in this alien environment is the voice of the interpreter. And it is the voice of the interpreter that allows this patient to connect with the doctor and to actually receive the health care that he deserves.
We all need to work together to advance health equity at every point of contact.